Good day, sir. My name is Stephanie Lee, your student nurse from J.H. Cirilia State College, Pagadian. I will be performing hand washing with antiseptic for today. Antiseptic hand wash. Washing hands with warm water and soap or antiseptic agent may kill bacteria and some viruses. Procedures. Step 1. Inspect hands for visible soiling, breaks, or cuts. Cover skin lesions before providing care. If lesions are too large, direct patient care is restricted. The rationale: open cuts can harbor microorganisms. Soiled hands may carry microorganisms. Step 2. Inspect fingernails. Fingernails must be short. Remove artificial nails, extenders, or polish. The rationale: harbor high concentrations of microorganisms. Increase microbial load on hands. Step 3. Push wristwatch and long uniform sleeves above wrist. Avoid wearing rings. The rationale: complete access to fingers, hands, and wrist. Step 4. Stand in front of the sink, keeping hands and uniform away from the sink surface. The rationale: the edge and inside of the sink are contaminated. Reaching over the sink increases risk of touching and contamination. Step 5. Turn on water with knee or foot pedals. For hand faucet, use paper towel to turn on the faucet. Discard paper towel in proper receptacle. The rationale: knee and foot pedals prevents hand contact with the faucet. Faucet handles are likely to be contaminated. Step 6. Avoid splashing water against uniform. The rationale: microorganisms can travel and grow in moisture. Step 7. Regulate flow of water so temperature is warm. The rationale: warm water removes less protective oils. Step 8. Wet hands and wrist thoroughly. Keep hands and forearms lower than the elbows during washing. The rationale: hands are the most contaminated part. Water flows from least to most contaminated area, rinsing microorganisms into the sink. Step 9. Apply antiseptic soap and rub hands together vigorously, lathering thoroughly. For liquid soap, apply 3 to 5 ml. For bar soap, rub firmly between hands. Rinse bar soap before returning. The rationale: ensures hands and fingers surface area are clean. Step 10. Wash hands using plenty of lather and friction for at least 15 seconds. Rub hands palm to palm. Rub back of each hand with palm of the other hand with fingers interlaced. Rub palm to palm with fingers interlaced. Rub with back of fingers to opposing palms with fingers interlocked. Rub each thumb clasped in opposite hand using a rotational movement. Rub tips of fingers in opposite palm in a circular motion. Rub each wrist with opposite hand. rationale, soap cleans by emulsifying fat and oil and lowering surface tension. Friction and rubbing mechanically loosen and remove dirt and transcend bacteria. Interlacing fingers and thumb ensures that all surfaces are cleansed. Adequate time is needed to expose skin surfaces to antimicrobial agent. Step 11. Clean under fingernails with fingernails of the other hand or with disposable nail cleaner, optional. The rationale, areas under nails are often contaminated, which increases the risk of infection. Step 12. Rinse hands and wrists thoroughly, keeping hands lower than elbows. The rationale, it washes away dirt and microorganisms. Step 13. Dry hands thoroughly from fingers to wrist and forearms with paper towel, single-use cloth, or warm air dryer. The rationale, drying from cleanest to least clean area avoids contamination, prevents chapping and roughened skin. Step 14. Discard paper towel in proper receptacle. The rationale, prevents transfer of microorganisms. Step 15. The last step. Turn off water. For hand faucet, use clean, dry paper towel. Avoid touching handles with hands. Discard paper towel in proper receptacle. The rationale, wet towel and hands allow transfer of pathogens from faucet to hands. Faucet handles are contaminated. That is all. Thank you.